Sickle Cell Disease Disorder, Part 1 of a 10-part series about invisible diseases and/or disorders. Sickle cell anemia or sickle cell disease is a genetic disease of the red blood cells, or RBCs. RBCs are shaped like discs, which give them flexibility to travel through even the smallest blood vessels. With sickle cell disease, the RBCs or red blood cells have an abnormal crescent shape resembling a sickle. This makes them sticky, rigid, and prone to getting trapped in small vessels, which block blood from reaching different parts of the body. This causes pain and tissue damage. The pain develops when sickle shaped RBCs block blood flow through tiny blood vessels to your chest, your abdomen, and joints. Really, the sickle shaped red blood cells can block tiny blood vessels anywhere blood flows. Pain can also occur in your bones. Episodes of pain are called crises. Pain can last for a few hours to a few weeks, which some people have only a few crises while others have dozens or more a year. Types of sickle cell disease. Hemoglobin SS disease. People with this type of sickle cell disease have copies of hemoglobin S genes from both parents. This is the most common type of sickle cell disease and is also known as HBSS or sickle cell anemia. This is the most severe form of sickle cell disease, and these people may experience the worst symptoms at a higher rate. Hemoglobin SC disease. This is the second most common type of sickle cell disease, also known as HBSC. People with this type of sickle cell disease inherit hemoglobin C gene from one parent and hemoglobin S gene from the other parent. It has similar symptoms to the sickle cell anemia, but it is less severe anemia. The third type of sickle cell disease is called hemoglobin SB plus, which is hemoglobin beta thalassemia plus. Beta thalassemia affects beta globin gene production. The size of your red blood cells are reduced due to less beta protein being made. If inherited with the hemoglobin S gene, you will have hemoglobin S beta thalassemia, which is also known as sickle cell beta thalassemia plus. Symptoms are not as severe as sickle cell anemia or sickle cell SC. Hemoglobin SB0 is the fourth most common type of sickle cell disease, which is also involving the beta globin gene. This type of sickle cell disease has symptoms similar to sickle cell, the hemoglobin SS or sickle cell anemia, but sometimes more severe and also has a very poor prognosis. Hemoglobin SD disease. People with this type of sickle cell disease have inherited the hemoglobin D gene from one parent and the hemoglobin S gene from the other parent. Most individuals with hemoglobin SD have fewer problems with infections and spleen involvement, fewer pain episodes, and less organ damage than the more common forms of sickle cell disease. Now, these next two are even less, um, I guess, common. I haven't met anyone personally with hemoglobin SE or hemoglobin SO, or even talked to anyone that has it. But hemoglobin SE disease, people with this type of sickle cell disease have inherited a hemoglobin E gene from one parent and a hemoglobin S gene from the other parent. People aged 18 and under are usually well. Ages 20 and older develop sickling complications, including acute chest syndrome. Hemoglobin SE is similar in fashion to hemoglobin SB, which again is sickle beta plus. They have milder symptoms and pain episodes. Hemoglobin SO, people with this type of sickle cell disease have inherited hemoglobin S from one parent and hemoglobin O Arbit. I don't exactly know exactly how to say it, but it's hemoglobin O ARAB from the other parent, which gives them sickle cell sickle cell I don't know how to say that. Let me try this again. That will give them hemoglobin SO-ARAB. It's rare, but it is suspected in people with known sickle cell trait who have an unexpectedly severe crisis reminiscent of sickle cell anemia. And last but not least is hemoglobin S. This is also called sickle cell trait. When you only inherit one copy of the S gene, these people may have no symptoms or reduced symptoms. Sickle cell disease is an autosomal recessive condition, which means you must have two copies of the gene to have the disease. If you have only one, you are said to have sickle cell trait. Sickle cell disease is more common in people of African descent, including African Americans, Hispanic Americans from Central and South America, people of Middle Eastern, Asian, Indian, or Mediterranean descent. Sickle cell trait actually affects between 1 and 3 million Americans, 8 to 10% of which are African Americans. Symptoms of sickle cell disease disorder. Symptoms of sickle cell disease usually shows up as early as ages 4 to 6 months. Symptoms include, but are not limited to, excessive fatigue or irritability, fussiness in babies, bedwetting, jaundice, swelling and pain in the hands and feet, frequent infections, pain in the chest, back, arms, or legs. Everyday health problems and complications of sickle cell include septicemia, acute splenectic sequestration, sudden pain, swelling of the hands and feet, fever, increased infections, anemia, chest and pain and trouble breathing, pneumonia, blindness, pulmonary hypertension, renal failure, stroke, blood and urine, leg ulcers, gallstones, vision problems, organ damage, kidney failure, painful erection for males, problems during pregnancies for females, delayed growth in children, dental problems, acute chest syndrome, which is really life threatening, avascular necrosis, which is the deterioration of your basically your bone socket where your shoulders and your hips and things connect, and also seizures, and the worst complication is death. This is a just a glimpse, an up close look at some battle scars from some fellow warriors. And these are some very good advocates that you can usually find on Facebook as well as YouTube. Sickle Cell Warriors. Their website is www.sicklecellwarriors.com. And Super Moms with Sickle Cell, their website is www.supermomwithsicklecell.org. Check them out, support the cause. We need to get more information out about sickle cell. Thank you for tuning in, and please like, share, comment, and subscribe for more information and more videos on my channel. Thank you for tuning in.